Good afternoon. This is Paul Casey. I'm the Chief Medical Officer at Rush University Medical Center, and I just wanted to provide a quick update in terms of where we stand here at Rush University Medical Center, as well as across the country when it comes to coronavirus. So I think most importantly, we have been seeing more cases of coronavirus, as you've likely heard, here at Rush University Medical Center, also across the system at our partner hospitals, Rush Oak Park and Rush Copley. And we expect that to continue. We're going to see more cases, more sick patients as we have to this point. The important thing is the pace at which we're seeing that rise in cases. And I will say we're encouraged by some of the early data showing that the steps that we put into place, the mitigation steps that were put into place both locally here at Rush as well as at the state level, seem to be having an impact in terms of slowing the rise of those cases. So what's happened in many cities throughout the world is the cases rose so quickly that they soon outpaced the ability of the healthcare system to really take care of those patients. It was too many beds, too many ventilators required, and just really too many patients for the given number of beds in a single city or in a single hospital. So we are encouraged, looking at the daily numbers that we follow closely, that because of those mitigation steps, we're continuing to see a rise, but at a slower pace than has been experienced in a lot of other cities throughout the world. And that will really help us in our ability to take care of patients as they come into Rush. And I think it's important as well, we've tried to always stay a step or two ahead of this. And I think we've been successful to this point in trying to grow into some of those surge operations. So you've likely seen throughout the medical center some of the examples of that. Our forward triage in the ambulance bay, where patients are with influenza-like symptoms are separated off to through the ambulance bay, and we really are seeing people in an efficient manner there. You've likely seen the Brennan Pavilion, where we've added additional capacity to try to offload the emergency department in the case that we continue to see more cases coming through the emergency department. There's been the growth in inpatient beds as well. We stood up a new intensive care unit, which is really an incredible effort to be able to stand that up. And we did it in relative short order with an incredible team. So I also want to touch base on our PPE, as I know that's a question that's come up frequently as I've rounded on the floors. And what I can tell you with confidence is that we are actually in very good shape in terms of our PPE. And that's really thanks to the leaders in our supply chain who have worked day and night, making sure not just that we're monitoring the PPE used throughout the medical center, but also taking every opportunity to procure more PPE, whether that's through the state, through our local government as well, or through different partners and vendors that we have. So they've really done an outstanding job in doing that. We're continuing to follow the guidance of the CDC, as well as the Illinois Department of Public Health and the Chicago Department of Public Health, in terms of the type of PPE, in terms of where we are deploying PPE as well. So on that front, we're watching everything closely. I appreciate all the feedback that we've gotten around that. And again, we are confident that we have the PPE not just to keep staff safe for tomorrow, but to keep them safe in the weeks and months ahead. Because that's the really critical piece here, is that we want to make sure that we continue to protect staff. Hearing some of the stories coming out of other hospitals that are running short, we never want that to happen for our staff here at Rush. So something we're really laser focused on ensuring. And then the final piece I'd like to talk about is just how inspired I am and how inspired I think everyone is by the teams that have come together in this effort. It's really been incredible walking through our new 5-atrium ICU, which was our old surgical intensive care unit, seeing a team come together that had not worked together before, and even with residents from different departments, it was inspiring to see the way that they flawlessly were able to take patients into that unit, take care of those patients, under the guidance of Dr. Balk as well, who's just an outstanding critical care and nationally renowned physician in his field as well. So I think we're seeing examples of that everywhere throughout the medical center. I see it when I walk around the emergency department. I see it when I walk around our COVID units up in the tower. I see it in our ICUs as well. So it's really inspiring that I think, understandably, this is a time of a lot of uncertainty and a lot of anxiety as we know cases are going to continue to build. But the one thing that we can really rely on is teams coming together here at Rush and starting to see that really turn into action and people just taking care of sick patients like we always have. So I just want to thank everyone for their efforts. It's impressive, it's inspiring, and we'll continue to do that, I hope, in the weeks and months to come. Thanks.